Welcome back, everyone. A spike in HIV cases connected to IV drug use has healthcare professionals in Massachusetts worried.
Well, according to the State Department of Public Health and the Centers for Disease Control and Prevention, the number of HIV infections related to drug use in 2018 was 3,722. That's at least 200 more cases than the year before.
A Western Mass News reporter Kayla Burton digs deeper into possible reasons for the spike in these new cases of HIV.
Renewed concern about the spread of HIV in Massachusetts after a new study found infections on the rise, particularly among IV drug users. Infectious disease doctor at Bay State, Daniel Skeets, tells Western Mass News he's not surprised.
Some of the people who do inject drugs don't realize that reusing a needle is not a good idea. Even if they clean it, it's better to reuse a new needle because that actually can cause significant tears in the skin, and that increases the risk for bacterial infections. And we're seeing a lot of bacterial infections.
There has been controversy in the state over adding more safe injection sites. But after seeing the results of this latest study, Tapestry's Director of Harm Reduction, Liz Wynot, says there's no question more needle exchange programs are needed.
Unfortunately, that rise hasn't been met with enough resources or support for both people that use drugs and aren't ready to stop treatment and for those people that are ready to stop using and need recovery-based services.
Wynot says the stereotype around those who use drugs has been misconstrued and plays a pretty big role as to why there's only a limited amount of resources available.
People put their judgments on people that use drugs, and make blank statements saying like people shouldn't be using drugs. We need to focus people that are clean and in recovery. But unfortunately, that rhetoric hasn't changed the reality of people are going to use drugs whether we want them to or not. And I think it just shows that we need to take our own personal feelings out of the equation and really focus on the science of what works.
As for Western Massachusetts, both Skeets and Wynot agree that if more is not done now to stop the spread of HIV among drug users, it will only get worse in the future. Kayla Burton, Western Mass News.